Hi, I'm Dr. Prashanth Gowda. I'm a neonatologist and pediatrician, and I'm the director of DYU Women and Child Care. In this session today, I will be giving information about fever convulsion or febrile convulsion or fever associated convulsion. Whenever child gets fever, especially between the age group of 0 to 6 years, 50% of the kid might develop what is called as fever associated convulsion. So in this, whenever there is sudden rise in temperature and sudden fall in temperature, these are the points where kid might throw convulsion. Convulsion means abnormal body movements and with altered consciousness. So this can be very frightening and scary for the parents when they are seeing in their kids. When we talk about febrile convulsion, when there is infection in the body, there is sudden rise, the body reacts to the infection by increasing the temperature. When temperature crosses, suddenly it rises and suddenly it drops. So these are the point where the kid might develop seizure activities. So whenever febrile convulsion happens, we advise not to put anything inside the mouth. Kid might have tongue biting, but usually it is a very short lasting. It can last for a few seconds to a minute. And try to keep the baby away from sharp objects when this episode happens, and do not put anything inside the mouth. Don't put water, don't put anything inside the mouth. And there's a myth and practice of giving a metal things in the hand, which should not be done. Try to secure the baby from the danger place, and usually it resolves on its own. And there are sprays which are available, intranasal sprays which are available, which can be sprayed into the nose. We call it as a midazolam spray or intramed spray. That can be used only on the advice of doctors. So whenever fever comes to the kid, 40 to 50% of the kids might develop fever associated convulsion, and this is something which is not going to hamper their growth and development. And this risk of fever convulsions are very common between 6 months to 2 years of age group. And whenever kids get fever, and especially who have a risk of fever associated convulsions, you can start the paracetamol or ibugesic, whichever works for the kid, every 4 to 6 hours. With this, and you can also do sponging. Take a lukewarm water and you can sponge the whole body to reduce the temperature. Try not to overdress or underdress the baby, and try to administer the medication. In case if kid is not able to take orally, you can use rectal suppositories to reduce the temperature. So by doing this, if kid has febrile convulsions, if it is not settling down within a minute, you have to visit the nearest hospital at the earliest. So these are the simple things which you can do whenever they have fever associated convulsions or febrile convulsions. And remember, febrile convulsions will not affect their growth and development. They'll have a normal development. The risk of recurrence of fever associated convulsion, whenever fever comes, can be there up to the age of 6 years, because that's a time when the complete maturation of the brain happens. 80% of the brain maturation happens by 2 years of age. That's why the commonest age group for this fever associated convulsion is 6 months to 2 years. However, they can also develop febrile convulsion up to the age of 6 years, and generally we don't see beyond 6 years. If any convulsions or fits happens without the onset of fever, without the trigger of fever, you have to take opinion of the pediatricians or the pediatric neurologist.